Hi, I'm Dr Lori Nigro, a cosmetic doctor and medical advisor to Mesoestetic UK. Today I'd like to cover some aspects of mesotherapy for skin rejuvenation, a cornerstone treatment of Mesoestetic. Mesotherapy is a well-established treatment in which combinations of liquid or gel compounds are injected intradermally, at specific depths and volumes, at multiple injection sites. This is to trigger corrective anti-aging processes within the skin. The treatment makes use of a variety of injection protocols, and Mesoestetic recommend 4 basic techniques. Firstly, Intradermal Nebosh, which involves the introduction of boluses of less than 0.1 milliliters at intervals of 5 to 6 millimeters and at a depth of 2 millimeters. This is achieved using a 4 millimeter needle at a 45-degree angle. Point-to-point is a similar technique, delivering larger boluses, 0.1 to 0.5 milliliters, at slightly greater depths of up to 3 millimeters, with the same spacing. The intradermal papule method is used when it is necessary to create a product reservoir in the dermis for a sustained effect. In this case, longer needles are used to create substrate papules at a depth of 2 to 3 millimeters. The fourth technique is linear tracing, a method particularly useful when addressing wrinkles or rhytids. A long needle is inserted deep and parallel to the line of skin fracture and withdrawn under pressure to leave a linear bolus. These 4 techniques, which require skill and experience, are the cornerstones of mesotherapy. Many practices use an injector device to simplify this process. Mesoestetic provide the MCT injector, a device which supports depth and dose consistency in all methods. Additionally, this device integrates carboxytherapy, CO2 gas, injected at the site to improve local microcirculation and collagen synthesis. To understand the treatment model of mesotherapy, it is useful to consider skin structure, particularly the extracellular matrix or ECM, which is the 3-dimensional network of macromolecules which include elastin, collagen, and other glycoproteins in the intercellular space that support skin structure and appearance. Significant drivers of aging skin include loss of collagen and elastin in the matrix, causing volume loss and laxity, downregulation of the collagen 1:3 ratio, compromising natural repair, oxidative damage and degradation of the matrix itself, and hyper or irregular pigmentation. Mesotherapy for skin rejuvenation is designed to locally ameliorate these categories of damage. I now want to outline some of the key ingredients of Mesoestetic's Mesohyal range, along with the clinical evidence for their standalone efficacy. All Mesoestetic consumables bear the CE mark, which certifies that they comply with the relevant EU directive on medical devices. Unless otherwise specified, they can be used in combination to support a desired effect or treatment outcome. Mesohyal hyaluronic is exactly what it sounds like, a concentrated solution of non-reticulated hyaluronic acid, or HA. HA is a glycosaminoglycan, which is a key component of the ECM. This is the base of all treatments in the Mesohyal range. In addition to its multiple intrinsic effects, HA is useful as a base delivery substrate for other pharmacologically active ingredients. Because of its mucoadhesive, biodegradable, biocompatible, and non-toxic nature. In young adults, approximately 50% of the body's HA content is found in the skin, but this diminishes rapidly to 0 during skin senescence and is linked with subcutaneous volume loss and skin aging. Studies associate increased HA with scar-free healing and an increased synthetic ratio of collagen 1:3, improving skin quality. Hyaluronic has demonstrated significant and sustained improvements in skin elasticity and complexion radiance. Another important ingredient is Mesohyal organic silicon, This is a solution of highly bioavailable organosilicates in an HA solution. In humans, silicon metabolism occurs in the thymus, which atrophies rapidly with aging, and silicon is critical in synthesis of elastin and collagen, as well as collagen cross-polymerization. The local injection of bioavailable organic silicon has been shown to upregulate hyaluronan synthase 2 and proline hydroxylase, improving fibroblast resilience, local HA synthesis, maintenance of HA levels, and mitigation of stem cell senescence. Synergistic use of injectable organic silicon along with HA maximizes bioavailability of local components for collagen synthesis, polymerization, tightening, and improvement of collagen 1:3 ratios. Mesohyal X-DNA is a relatively new ingredient in mesotherapy, containing highly polymerized fragments of DNA. X-DNA improves wound healing, diminishes inflammation, and upregulates metabolism in the fibroblasts, which produce collagen. X-DNA supports the formation and synthesis of collagen type 1 proteins in vivo, in preference to collagen 3. This leads to a denser ECM and smoother, younger-looking skin. Mesohyal DMAE has broad clinical indications. Increased rigidity of the cervicofacial region was noted with oral administration of DMAE for unrelated conditions as early as the 1970s. Non-toxic 0.1 to 0.2% microdoses of DMAE can be delivered intradermally via mesotherapy and have been shown to reduce the epidermal and dermal thinning associated with aging, and to counteract the age-related upregulation of collagen 3 relative to collagen 1. DMAE has also been shown through in vivo trials to improve dermal thickness and water content of the stratum corneum. Lastly, Mesohyal NCTC-109 is an HA-based solution which includes multivitamins, amino acids, minerals, and coenzymes. These adaptogens can provide adjunctive and direct therapeutic effects, and Mesohyal also includes a number of specific ingredients for skin rejuvenation. For instance, Mesohyal vitamin C assists with controlling hyperpigmentation and provides direct antioxidant protection. Vitamin C also increases the number of fibroblasts and so upregulates collagen production. Mesohyal carnitine upregulates lipolysis and fat metabolism and is indicated in the treatment of cellulite. Mesoestetic UK can provide training and assistance with specific treatment plans as per patient requirements. However, in order to support a general understanding of product efficacy, I would like to present the clinically evaluated results of 3 common protocols for facial rejuvenation. For treating a dull, uneven, pigmented or parchment-like skin, a typical protocol could include 5 treatments of 5 ml NCTC-109 and 5 ml vitamin C. This treatment demonstrates a 94% reduction in oxidation and a 33% reduction in melanin synthesis. A baseline wrinkle correction and skin rejuvenative treatment comprises 5 treatments with 3 ml of hyaluronic and 5 ml organic silicon. Improvement evaluation in vivo and in vitro included a 93% increase in dermal regeneration and a 20% improvement in quantitative skin elasticity. A combination of 3 ml of XDNA and 5 ml of DMAE is utilized again over 5 treatments to support firming and lifting of the face. Clinical outcomes include a 28% increase in collagen synthesis, a 26% improvement in skin firmness, and a 15% increase in measured dermal density. So I hope that's been a useful whirlwind tour of the Mesohyal product range, at least as far as its applications for facial rejuvenation go. If you'd like to find out more about incorporating mesotherapy into your practice, you can find additional information by following the links below. Alternatively, contact us by phone or email. You can find us on social media on Facebook, Instagram, and Twitter. Thanks for watching.